I drew this sample few minutes ago. Guess what? Not more than 20 minutes and this has already happened. So what clicks into our mind if we get such kinds of sample is anemia. Remember, we don't fully interact with the patients, but we interact with their sample, and their samples tells us a lot of things. So just check on this. Yeah, it looks crazy. The amber part, amber, this fluid that has a color almost like a urine color is the plasma. Then we have the packed cells here. In between, we have the white blood cells and the platelets, and the this one down here that looks almost black is the red blood cells. So from here I can clearly tell the patient is having very low red blood cells level as well as the hemoglobin level. So from here, unless I do a test and I can tell more, the results will tell me more about the patient even without asking the patient any question. So let's proceed and see the results. There are a number of anemias. We have the pernicious anemia. This happens mostly when there is lack of intrinsic factors. Remember, in the gastric mucosa, we should have the intrinsic factors that help in the absorption of vitamin B12. We also have the iron deficiency anemia. This happens when you lack ions. And again, we have the aplastic anemia. This happens when there is a condition with the bone marrow, and this really affects the production of blood. Then we have hemolytic anemia. This happens when you have bleeding, an accident or something, and in this case you are losing more blood than your body can replace. We also have others like thalassemia and the G6PD deficiency. Sorry, I forgot sickle cell anemia. It's also one of the important anemias in the clinical study. So our result is out. As you can see, from the WBC panel, we go to the RBC panel, then we go to the platelet panel. So from the WBCs, you can clearly see our patient has some infection in blood, probably bacterial infection. Granulocytes are high, both the number and percentage. Our main interest is the red blood cells and its indices. So RBC we have 2.15, that's low. The normal should start from 3.5 to around 5. The HB we have 4.0, and this is critically low. So this patient is a candidate of blood transfusion. HB should start from 11 to 16 for females, so this is low. We have the HCT. HCT is the hematocrit or packed cell volume at 14.8, and it should start from 37 to 47. So that also is critically low. We have the MCV, mean cell volume. So the number of these, if it's low, it indicates that the cells are microcytic. If it is high, it shows that the cells are macrocytic. From here we can have a clue that the patient might be having iron deficiency anemia, but this result should be supported with the PBF, which will clearly give us the staining characteristics of the red blood cells and the variations, the distance between them, the sizes and shapes, things like that. So we have the MCH next, mean cell hemoglobin. So this will be low because the RBCs, the HB was already low. We have the MCHC, mean cell hemoglobin concentration, so that's 32, that's okay. We have the RDWCV, which is the red cell distribution with coefficient of variation at 14.4, that's okay. And then we have the red blood cell distribution with standard deviation at 32.3, which is low. It should start from 35. And if we go to platelets, we get it's 237. That's normal, that's okay. It should start from around 150 to 450. Then we have other indices of the platelets. So with all these, we can have a clue that our patient is having microcytic anemia, but we don't know specifically if they are normochromic, normocytic, or something. So I'll have a clue our patient is having iron deficiency anemia, but other tests to follow to confirm that. Thank you for watching.